Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex to self-love to questions about body parts. Let's get this episode started. I am dedicating this episode to one very big question, and that is what you can expect when you go for a doctor's appointment. So there are many reasons that a teenager might need to go to a doctor, but it's recommended that once a year a teenager go for a general checkup. There are a few things that you can expect from a doctor's visit. So let's pretend like you just got to the doctor with your parents. Might be just one parent, might be both. So you come into the room and you sit down, and the nurse or medical assistant will take your vitals. So that means measure your blood pressure, listen for your heart rate, listen for your breathing rate, and maybe your oxygen levels. And then they'll do your height and weight. So weight. Weight can be a very uncomfortable part of an exam for some people, and that's okay. What I would encourage you to do is talk to your provider if you are uncomfortable getting on the scale. There are many reasons why we want to look at weight and monitor weight, but we can also talk through things as well if it makes you uncomfortable. So it's your body, and you never have to do anything that you're uncomfortable doing. So that's kind of the general check-in part of it. And then the doctor, maybe the nurse, maybe the medical assistant will go through some questions for you and for your parent. Things like how you've been feeling, if you've had any recent upset stomach, if you're eating well, if you have had any colds recently, if you have allergies, any cuts or bone breaks, or any sort of thing that a doctor would want to know about. So they'll cover all of those things with your parents. So after kind of all the basic conversation stuff is done with, it's usually around the age of 13 or 14 or so when a doctor will ask your parents to step out. Ultimately, it's going to be up to you guys if a parent leaves, but from a provider standpoint, we like to introduce the topic as this is a great opportunity for your child to get to learn how to take control of their own health. And so we like to practice by having the parents step out of the room while we talk to the patient one-on-one. And most parents are okay with this, and they'll step out of the room. Now, if you're not comfortable with this, you can say no, I don't want my parent to leave, and that's totally fine. If they do step out though, these are the kinds of questions that you can expect from the provider, okay? We go through something called heads, and every letter stands for something. So the first thing we'll ask about is home environment. How are things going for you at home? Are you getting along with your brothers and sisters, or your parents, or your aunts and uncles, or whoever lives in the home with you? Then we'll ask about education, and we'll want to know how school is going, because that really does contribute to mental health. If you're struggling in something, if you're having a hard time concentrating, if you're being bullied, all of these things are really important for a doctor to know. The next thing we'll want to know is activities. So, are you physically active? What kind of things are you doing? Then we'll want to talk about some more serious things, like drugs or alcohol, if you've ever tried drugs or used alcohol. And the reason that we want to ask these questions is really just to know what you're doing, and if we can provide any insight or guidance on ways that you can be safe, or tell you why we don't usually recommend drugs or alcohol for someone who's a teenager. The next thing we'll ask about is depression. If you've been feeling extreme feelings of sadness or anxiety or any other mental health issues. Next up comes thoughts of suicide. So if you've had any thoughts of hurting yourself or killing yourself. All of these things are really important topics that a doctor will want to know. And a doctor would potentially be able to help you with. And then the last thing we want to talk about, sex. If you're having sex, if you're interested in sex, who you're interested in, if it's male, female, both, neither, what types of sex you're having, so we can talk about ways that you can protect yourself, and ways that you can protect yourself against pregnancy. It's also a chance for us to talk about sexually transmitted infections, or STIs, and it's possible that we can do testing for you that day as well. So all of those questions are ones that we generally like to ask when a parent is out of the room. If you have an open relationship with your parents and you're okay talking about those things in front of them, that is wonderful. But we like to ask a parent to step out so that you can vocalize your own concerns. Very important point. You are the primary focus of a doctor, not your parents, not your siblings, you. We are here for you. And so usually the information that is shared is totally confidential, meaning that it stays between you and me. Now, the only reason that we would have to tell your parents something is if we are worried about your safety or you hurting someone. So if you tell us that you are having thoughts of suicide, if you are having thoughts of hurting yourself, or if you are thinking of hurting someone else, or if someone is hurting you, then we need to tell your parents, because those are immediate health concerns. Those are immediate safety concerns. And those are the specific reasons why we would share something that is otherwise told just to us, okay? But otherwise, the issues that we talk about should remain confidential. Now, after we talk about all of the uncomfortable stuff, then comes the physical exam. And that's going to be a good head to toe. Depending on if you are doing sports, we might do some extra movements or some funny squats or reflexes or something like that. But usually a good physical exam is going to be a head to toe evaluation of all of your systems, including the reproductive system. So that's going to be a genital exam. Why are we looking? It is actually super important in teenagers because you're going through puberty, and we need to make sure that things are proceeding as they should, that you are developing through puberty appropriately and on time. I know it's going to be awkward, and we'll do our best to let you run the show. So if you are uncomfortable with a certain exam part, we can have your parents in the room, we can have a chaperone in the room, meaning an assistant that comes in and kind of hangs out with you. It might be a little awkward, but we really just want to make sure that everything is developing as it should. Now, for those who were born with male reproductive organs, the penis and the testicles. As a teenager, some doctors will do a hernia check, which means feeling up in your scrotum or your sac and feeling if anything kind of bulges out. It's not super necessary as a teenager, and so don't expect every doctor to do it. But what a doctor will want to look at with that exam is going to be if you have two testicles and if your penis and your testicles are developing along a normal puberty timeline. They'll also want to look at pubic hair and make sure that's coming in too. Now, if you were born with female body parts, what the physical exam is going to be is basically looking in the vaginal region, making sure that pubic hair is coming in appropriately, and going through a breast exam with you. So showing you how to feel breasts for any lumps or bumps, and making sure that you're developing appropriately. And that's it. There's a lot of concern about the vaginal speculum exam. So you should know that is not necessary until you are 21. So no need for a doctor to look in your vagina unless there's a specific reason. But we don't do that on a yearly exam, not until you're 21. So breathe easy, okay? And then that's kind of it. Again, if you have any concerns or questions, ask your doctor. And it is always your right to say no. So if you are super uncomfortable about something, you can say, I don't want you to look down there right now. Or maybe we can look next year. But there are ways to get through the exam so that you don't feel like you have been violated. That's very important. But that is what you can expect from a doctor's visit during the teen years. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.